Colleagues online, can you hear us in the room? If yes, we will pass over to our moderator for this session, Karen Wu.
Yes, we can hear you.
Brilliant. Over to you, Karen.
Thank you, Tamily. Sawadika. Welcome to everyone. Good morning, good afternoon to all participants who are joining this webinar in the conference room and those online. My name is Karen Wu. I am the Senior Coordinator on Early Warning Systems with the ITU, and I'm the moderator for today. I am very pleased to welcome everyone to today's third session of the Asia Pacific Early Warnings for All webinar series Apologies, I forgot to turn on my camera. On science, technology, and innovation. This webinar is conducted in a hybrid format. Today's webinar focuses on leveraging the opportunities of science, technology, and digitalization, including artificial intelligence, machine learning, to advance multi-hazard early warnings into early action. Before we start, let's go through some housekeeping rules. Can you help to display the next slide? Thank you. So we will use the Q&A function in MS Teams for your questions. Please feel free to put in your questions in the Q&A panel. There could be a Mentimeter participation if we have some time. Please note that this session is recorded. All speakers, please limit your presentations to 5 to 6 minutes, and the moderator myself will provide some reminders to ensure that we proceed on time. And please keep your microphones muted unless you're speaking, and you may raise your hand when you wish to speak, especially in the room. Thank you. It gives me great pleasure to invite Mr. Ben Churchill, the Director, Regional Office for Asia and the Southwest Pacific, World Meteorological Organization, to provide his welcome remarks. Over to you.
Well, thank you very much, Karen, and good morning, good afternoon, good evening to all of you. It's nice to see some familiar faces and new faces in the room, and also want to acknowledge over 100, I think it's approaching 200 participants have registered online, so we'll see how many we get up to. But this is a very exciting opportunity. My name's Ben Churchill. I'm the Director of the World Meteorological Organization's Regional Office for Asia and the Southwest Pacific. I've been asked to provide some opening remarks. I'll keep them quite brief, and I'm just going to break it into two parts. I want to do sort of a retrospective, a look back, and then a look forward. So looking back at how far we've come in my lifetime. I'll confess I was born in the 70s, and also looking forward, what are the priorities for science, technology and innovation as it relates to multi-hazard early warning systems and the Early Warnings for All initiative as introduced by Karen. So looking back, when I was quite young in the 1970s, of course we didn't have mobile phones, and in fact communication was just through landline phone. Satellites were just becoming sort of a thing at the time in terms of remote observation, remote sensing of our planet, mostly in terms of earth sciences, and at the very early stages, meteorology, in terms of understanding what the atmosphere is doing. Fast forward to the 80s and 90s, and we're starting to see more like satellite communication becoming more widespread. Things like internet emails, which we take for granted now, we're just, basically being pioneered and tested. Data storage has improved significantly by that time, which enabled data sharing and collection and storage. Supercomputers started to become more prominent, which unlocked a lot of potential in terms of research and operations as it applies to weather forecasting and warnings in particular. Numerical weather prediction, which sounds a little bit sort of technical, but that's the ability to process all this data and produce meaningful forecasts and warnings, which can then be tailored to specific end user needs and sectors. Then we move into the 2000s. Of course, we had mobile phones, but then we had the emergence of smartphones, which then allows us to have effectively a warning siren in our pockets. And I know not everyone on the planet has a mobile phone, but the digital sort of connection is spreading very quickly. And enabling this, we have the Common Alert Protocol, which connects the forecasts and warnings to communication systems. And we have now emerging technology in terms of cell broadcast and also satellites, which are really sort of narrowing down the forecast warnings, so they're more specific geographically and also in terms of the end user. So that's sort of a bit of a look back in terms of how we've come. And of course, we're now in a very interesting time with artificial intelligence and machine learning, which are speeding up processes and really sort of making it more possible to imagine very interesting concepts in terms of how we interact with the data, how we receive the data, how we then turn these digital insights into action. So looking forward, and one of the tasks I've been given as an opening speaker is to identify some of the priorities. I'm going to move through them very quickly because I'm very conscious of time. But what I'd really like to stress, and I'm really looking forward to hearing some perspectives from our speakers today, in terms of partnerships. This is absolutely key. In a region like Asia Pacific, we rely very heavily on effective partnerships, working together across domains in the public sector, the private sector, and also academia. So this is very critical for science, technology, and innovation to be successful. We also need to co-design across these sort of areas to make sure that whatever we're producing in terms of new technology and applications is relevant and can be used and actioned by the end users, particularly the most vulnerable and the hardest to reach. Social science is often overlooked. Integrating traditional knowledge, cultural context into our early warnings is becoming more and more critical. If we're going to make early warnings for all a success, we need to reach everybody. We need to go beyond our current sort of understanding of what we think is success. We need to redefine success and make it reach everybody and be relatable and translatable into effective action. And I think another thing that I'd really like to underline here is communication. And I don't mean in the sense of ITU and communication, I mean like broad communication of science, technology and innovation, making it accessible and relatable. And this requires a deep understanding of the impact we're having. And I think it's an opportunity for all of us to think about how we communicate our impact, how we communicate our insights and turn those into action. And just a small plug for the WMO, we are celebrating our 75th anniversary this year, and our theme, our motto is Science for Action. So I think just to sort of get things started, I really want us to think about how we take this science, technology, innovation, the things we hear about today, and how we turn them into action that helps people, that saves people's lives, protects livelihoods. So with these words, I did say I'd be brief. I will hand back to Karen and welcome everybody. And I really look forward to your active engagement and participation, including everybody online and everybody here in the auditorium. Thank you very much, Karen.
Thank you, Ben, for your wonderful and inspiring remarks to start us off on a very good start. So let us now start with the presentations. If you have questions, please type in the Q&A panel in Teams. We would have some time for question and answer after the presentations. With that, I'm going to introduce the first speaker, Mr. Satoshi Tomabeki, who is joining us online. He's the supervisor of the Hiroshima Prefectural Government Crisis Management Department, the Disaster Prevention Management Division of Japan. He's going to share a social media tool to promote evacuation behavior. Ms. Chinatsu Endo, who is in the conference room, will be assisting with the interpretation. With that, I'll give Mr. Tomabeki the floor.
ご紹介いただきました友部です。私は災害から命を守り、早めの避難の大切さを伝える仕事をしています。
Hello, this is Hiroshima Prefecture Officer Tomobechi, and my mission here is to protect lives from disasters and communicate the importance of early evacuation.
本日は発言の機会をいただきありがとうございます。
Thank you very much for giving me the opportunity to speak today.
Next. 日本では毎年洪水や土砂災害が起きていて、広島県でも2018年に大きな豪雨災害がありました。
In Japan, floods and landslides are happening every year, and then particularly in 2018 in Hiroshima, we experienced a major torrential rain disaster.
当時、災害の危険や避難の情報が住民に届いていましたが、避難した人は多くありませんでした。
When it happened, the authorities provided timely alert and warning, but not many people actually evacuated.
大学と調査した結果、避難を進めるには次のことが大切だと分かりました。住んでいる地域の災害リスクをあらかじめ知ること、避難場所や持ち物を準備すること、災害の兆しを感じ取ること、家族や近所の人が声を掛け合うこと。
So why this happened, that people didn't evacuate? In order to understand, we undertook a study with the university. The study indicated several key aspects that may help promote a future evacuation of people. The first one is to have people with knowledge of disaster risks where they live. The second one is to have a preparation of evacuation sites and supplies in advance. The third one is for people to have the ability to sense the signs that our conditions are not normal, that evacuation may be necessary. And lastly, to have family and neighbors checking on each other and encourage one another to evacuate.
これらを踏まえて、広島県ではマイタイムラインを推進しています。マイタイムラインは災害までの時間を逆算し、いつ何をするか自分で決めて計画するものです。
So based on those findings, Hiroshima Prefecture currently promotes what's called My Timeline. My Timeline is a plan where residents or individuals decide in advance what actions to take and when before disaster happens.
事前に地域の危険場所の確認や避難の準備を通じてより速やかで安全な避難を目指しています。
So we encourage citizens to identify hazardous and risky locations in the community and prepare for their own evacuation in advance for faster and safer evacuation when the time comes.
マイタイムライン作りには知識が必要です。そこで多くの人が使うメッセージアプリ LINE を活用し、簡単に作成できる方法を取り入れています。
Creating a personal evacuation timeline requires some knowledge. So to make it easier, we use Line app. It's a messaging app widely used in Japan to provide a simple way for people to create one.
Next. LINE を活用したマイタイムラインの機能を説明します。
I will explain the My Timeline function using Line.
LINE は日本で 94% の人が利用しており、高齢者にも広く浸透していることから、新しくダウンロードや登録をせずに使うことができます。
Line is used by about 94% of the people in Japan, including a large proportion of older adults. As most people already have the app installed and have an account set up in the phone, creating a My Timeline requires no additional downloads or registration.
ユーザーは自宅の住所や避難に時間がかかる家族の有無を入力するだけで、自動的にマイタイムラインが作られます。
Users simply enter information about their home location and family members who may take time to evacuate. Based on those information,
住む地域の避難情報が、住む地域の避難情報が LINE を通じて通知されます。
Based on the information such as home location, customized My Timeline is automatically generated, and during disasters, evacuation information for your area is delivered through Line app.
Sorry to disturb. You have 30 seconds left if you like to quickly wind up. Thank you.
Okay. 50 seconds, right? 50秒残ってるそうですが、続けて大丈夫です。
はい。 災害に関する情報は種類が多く、自分に関係するものは探すのが難しいです。そこで関係ある避難情報や避難先だけに絞って分かりやすく表示しています。
So there are many types of disaster-related information. It can be difficult to find what's relevant to you. So the system filters and displays only the evacuation information and shelters that apply to you to make it easy to understand. Next.
Next. 最後に、システムの仕組みについて簡単に説明します。
Finally, I'll briefly explain the system structure.
LINE には外部のシステムとつなぐ API という機能が用意されており、私たちはこれを使っています。
LINE offers an application programming interface API for integrating with external system, and we use this service.
右側のシステムで管理する防災情報と登録された情報を新たに構築した中央のシステムで結びつけて、ユーザーごとにマイタイムラインを作成します。
The disaster information managed in the existing system, which is on the right side of the slide, is linked with the registered address through the newly developed system, which is in the center, which then generates the personalized My timeline for each user.
災害時には右側のシステムから避難情報が送られ、中央のシステムを経て該当地域の利用者に LINE で通知されます。
During disaster, evacuation information is sent from the existing system on the right and passed through the system in the center, then delivered by line to users in the affected areas.
ユーザー数はまだ少ないですが、一人一人に合った情報を届け、避難を促したいと考えています。
It's been 2 years since we launched this system, and we'd like to increase the number of users. But our goal is to deliver personalized information and encourage timely evacuation.
離れて暮らす家族ともマイタイムラインを共有できる機能があり、他者からの避難の声かけのきっかけ作りに役立ったいと考えています。
The service also allows users to share their My timeline with family members living far away, helping create opportunities for loved ones to check in and encourage evacuation when needed.
以上で私の説明を終わります。ご清聴ありがとうございました。
That's it for my presentation. Thank you very much.
Thank you, Mr. Tomabeki, for sharing this insightful experience from Hiroshima Prefectural Government. It's very inspiring use of social media combined with behavioral science. Now, let me now move on to introduce the second speaker who is in the room, seated on the rostrum. Ms. Yu Zifeng is the Chief Engineer, Shanghai Typhoon Institute of the China Meteorological Administration. She will be sharing on an AI agent for multi-hazard early warning. The floor is yours, Ms. Yu.
Good morning, ladies and gentlemen. I'm Zifeng Yu from Shanghai Typhoon Institute. Firstly, I would like to thank the invitation from the ESCAP, and I have the chance to be here to introduce the China solution to early warnings for all. So firstly, I would like to introduce a Mazu Urban and Mazu TC. The next, please. As we know, the Mazu in the ancient time is godless. Yes, the goddess who provided the people in the coastal region from the storms and heavy rains in China. Nowadays, the Mazu is an AI agent. It is used for China's solution to early warnings for all. Mazu, it is multi-hazard and also zero-gap universal alert. It can be used as smart tablet, smartphone, and all-in-all terminal, and also used as a website, computer. We collaborate with the AI laboratory and also universities to develop with a focus such as Mazu Urban. It is focused on the multi-hazards in cities. Next, please. So based on the 4 pillars of early warning for all, we have used the AI techniques. This is a cutting-edge technology to help us to do how to improve the multi-hazard early warnings. For Pillar 1, we can use the AI build a high-quality corpus to help us to develop the AI models. Pillar 2, we can use the AI model to do the weather forecasting and the monitoring forecasting capabilities improvements. And Pillar 3, we can use the AI to improve the fast communication capability to do the warning dissemination and also the communication. And finally, we can use AI to create a guide for urban disaster prevention and mitigation. We can make a better decision to do the disaster prevention and mitigation. If you have any question about the Mazu Urban, you can contact the core member, Mr. Yang Yu. Yes. And next, please. So tropical cyclones is a extreme weather and disasters. So we have paid extreme attention about how to improve the tropical cyclones disaster prevention. We have developed the Mazu TC with a focus on tropical cyclones. Here, with the Mazu TC, we can find the tropical cyclone data sets such as the track, best track data, and also the rainfall and wind impacted data sets, and also forecast or reanalysis data sets. It is especially focused on the tropical cyclones. And further on, we can use the AI to empower the tropical cyclones monitoring and forecasting analysis, such as we can improve the longer near time forecast use of the AI techniques, and also we can make the AI techniques further to do the typhoon disaster risk and benefit assessment. We can focus on that to do the stream dynamic typhoon risk assessment, and further on we can do the typhoon progressive service response plan, such as we can make the longer time or early outlook of the tropical cyclones, the tropical cyclones genesis, initial stage monitoring, and also further on to focus on the tropical cyclones landfall process. So if you have any questions, you can contact my email here. The Mazu TC is focused on tropical cyclones AI agent. So I think I will stop here. If you have any question, you can contact me, and also maybe the CMA agent, and also we can also look forward for further cooperation and your suggestions. Thank you very much.
Thank you, Ms. Yu, for sharing the exciting use of AI in advancing early warnings and the two use cases of Mazu Urban and Mazu TC. And with that, we will now move on to our third speaker, who is also seated on the rostrum. Ms. Kamorat Prasopsuk is the Information Technology Officer of the National Disaster Warning Center, Department of Disaster Prevention and Mitigation, Ministry of Interior, Thailand. Ms. Prasopsuk will share on Thailand's experience in implementing mobile-based early warning system based on cell broadcast. Over to you.
Okay. Good morning, everyone. Again, I'm glad to be here. Okay, today I will be sharing insight and experience from cell broadcast in Thailand. Next, please. Okay, let me explain why we need the cell broadcast for Thailand. We have a lesson learned from the past disaster when the earthquake strike in Thailand, earthquake for Myanmar on 28th March this year. When the disaster happened, our warning system failed. We use SMS and internet message, but the system has big problem. When many people try to use their phone at the same time during disaster, the network gets too busy. Call don't work, message don't send. People cannot get help, and people in Thailand confused what happened. And our system has only send short message, but it was too slow. The cell broadcast is different because it works fast and use a different channel from normal phone call and internet. We can send warning to specific area. People don't need to download application. It's completely free and it can read message out loud for people who cannot see well. Next, please. Okay, inside Thailand cell broadcast system, we have two types of alert. First type is a central level alert we call Thailand alert. In our main office in Bangkok, send this warning we use for the big disaster such as earthquake, tsunami, big storm, and cold weather. We can see this different coming from our national monitoring system. And the second type is provincial or local alert level, warning that require local data from the officer because they know their area best. So they help to create warning message. Right now, we still helping local area learn how to use the system. Our central office helps them to create and send the message. Later, they will do by themselves. Next, please. Okay. What made it work? Thailand key success factor. I think have the three key success. First is strong collaboration. DDPM has a collaboration with the DE, Digital and Economic Society Ministry, and NBTC, National Broadcasting, Telecommunication, and Mobile Operator. And we have a clear standard operating procedure from trigger, approval, and broadcast the warning message. And we try to run many campaigns to teach people about the public communication to understand the cell broadcast system. Next, please. Cell broadcast is a new channel in Thailand. Now we have a challenge and some solution. First challenge is some mobile phone operating system cannot support cell broadcast. And the solution is we NDWC send the SMS along with sending cell broadcast and distribute notification message on all available channel. Okay. And next, early warning system is accessible to the public, but some people still lack of the awareness to evacuate in advance. The solution is accelerate public education and increase more social awareness. And the final is the overspill of the target area. The solution is build understanding and clearly specify the affected area in the notification message. Okay, that's the end of my presentation. Thank you for your attention. We DDPM try to improve warning system capability to save life economy. Thank you very much.
Thank you, Ms. Prasop, for your insights and sharing Thailand's journey in implementing cell broadcast. Now I'd like to take this opportunity to introduce our fourth speaker for today, who is joining us online, Ms. Eka Wulan Chayasa, who is the Head of Health and Social Services, Indonesian Red Cross National Headquarters. She will share Indonesia's experience with a community-based surveillance information system for disease early detection and action. Ms. Eka, the floor is yours.
Thank you, Ms. Karen. Good morning for all the audience and speakers, both attending in the room and also in the online. So yes, as it mentions that I will share for the community-based surveillance systems for strengthening early action and early detection and early actions. Can we share to the next slide? Yeah, thank you. For community-based surveillance, the first question will be why it's needed. So you can see in the pictures that large scale of epidemic and pandemic are cause global concern. And then community are often the first notice when unusual event occurring and the last stop feeling the impacts. From the pictures, we see that if in the community, if there is 5 sick person, for example, it can be happen, can be happen, like, for example, one of them may be dead, one of them may be unknown or not aware to refer to the health facilities. Some of them maybe go to the pharmacies to take their own medicine without diagnose. And then some of them maybe goes to the traditional healer, and maybe one of them also goes to the health facilities for health seeking their behavior. So what we learn from this situation? So of course, there are potential underreporting case at the community. So because we strongly feel that community are often, and community have a key role to play to prevent, detect, and quickly respond to the outbreak, and they can have important role to saving countless life and promoting healthier communities. So we train and support early detection and reporting significant health events within the community by the community members. And then we train them to recognize signs and symptoms and of targeted disease, and also train them how to report, when and where, and then how to react. And then we provide them the ability to do like first aid, home care, and then facilitate them with a public health center in their areas. And then we give them set of skills for community case definitions to report to the local health and veterinary authorities. So for community case definition, actually is easily identified. Symptoms are used by broadly recognized as specific disease, and it can be easily used by the community members, even though with no medical background, and volunteers are also share these affected community members and support early action to prevent the spread of the disease. So actually, there is a type of the list of the priority disease, both for the human health and animal health. Yeah. So we know that support community-based surveillance system, we need integrated reporting system is needed. Next slide. So yeah, actually this is our modalities for community-based surveillance. We have paper-based, especially for volunteers and supervisors. We provide them with volunteer and supervised book and record alert form and also remote tracking form. And we also have another experience using SMS and Kobo, but it's no longer now. We are using web application both for mobile phone and also the dashboard. So next slide. Yeah, so we are using paper-based and also Satu SBM integrated information system for community-based surveillance. For paper-based, actually we do for in the area that very remote and the internet access is very limited. But for those who have internet access and then can use the system. Actually, this information system is custom software that was developed for data collection, management, and analysis. So how it's work? So the community member report a health risk to other trained community volunteers, and the community volunteers report an alert into Satu SBM applications. So their supervisor will receive a notifications and must verify the alert in less than 12 hours and provide them with guidance and follow-up actions. And this verification process is aimed to gather more information about the alert and to ensure that it corresponds to the community case definition, of course. In order to reduce the number of false alerts, so the verification alert then immediately report to the local human or animal health officials to more
Sorry.
if investigation and treatment required. So
Sorry,
yes.
Ms. Eka, you have 30 seconds.
Okay, yeah. So
Thank you.
so thank you, Karen. So this alert will be, the feedback will be true alert or false alert. If false, the system will be closed by the supervisor. And if it's true, it will be escalated to the supervisor, to the human health and health authorities. So yeah, after the supervisor will receive the information from the health authorities about the outcomes of the investigations. So the alert confirm positive, especially for health, positive alert confirmed by health authorities. So we will, the system will guide the volunteer on the follow-up action to reduce the spread of the disease. So we can use also this dashboard for interface to support decision makers. So please, next slide, the last one. Yeah, thank you. So actually, for this, this is what happened during the days. Yeah, so what we do during the year, so after this piloting, we escalate into 11 province. We start with 4 province and into the 11 province, and these lessons learned are endorsed by the government, and then we have national government by Permenko PMK for zoonotic control and other infectious disease. And we developed together with the Ministry of Health for training curricula and TOT, and then escalate and piloting again in national CBS piloting under Ministry of Health in all districts in West Java and Central Java. So if you see in the pictures, so actually community-based surveillance is raising community voices into existing surveillance system by the government, both for the animal health and also for the human health. And yeah, this is the way the community-based surveillance filling the gap from the existing surveillance system. Thank you.
Thank you, Ms.
Karen.
Eka. Thank you, Ms. Eka, for your kind and valuable feedback on the community-based information system. I'd like to use the next 10 minutes to ask some questions to each of our speakers so that they can provide some reflections in about 2 minutes. Let me start with Mr. Tomabeki. In some countries, simulations are used to create public awareness. In your experience, how would you see the role of the line by timeline in complementing public awareness exercises?
友部さん訳しますね。普段から、早期警報とか避難ということに関して、普段から国民の、市民の意識を高めるのによくシミュレーションとか避難訓練っていうものをすると。で、マイタイムラインもこうやって、市民の意識を高めるっていう取り組みをする上で、どういったその補完的な役割を果たすとお考えですか？
はい。質問ありがとうございます。まず、マイタイムラインはツールなので、どのような形であったとしてもいいのですが、まず自分のリスクを理解する、どう行動したらいいかを理解する、考えるということが非常に大事だと思っています。
Thanks for the question. First of all, my timeline is just a tool, but what's important behind this tool is really to enable people to really understand what kind of risk is surrounding people.
Thank you very much,
なので
Mr.
マイタイムラインを使った家族で一緒に考えるとか、学校で一緒に学ぶとかっていう機会で、子どもたちに、考えていただいて、子どもたちを通じて親世代ということで、家族一緒で考えるということも重要だと考えておりますので、防災教育に力を入れております。以上です。
So the process of creating my timeline really requires the engagement within family members. So in that process, people can speak and discuss with the kids and older generation of people in the family perhaps persons with disability, and try to really understand how they're going to act as a family. In that process, it's all about education, right? The kids get to discuss about it, and that stimulates parents thinking. And the whole system of my timeline building is actually awareness raising. So that's how Hiroshima Prefecture promotes the awareness raising around disaster risk reduction and early warning system.
Thank you, Mr. Tomabechi, for your kind reflections. Now let me turn to Ms. Yu. Your presentation shows that Matsu TC focuses on tropical storm. Could this AI platform be adapted to other hazards, and how long would it take for the adaptation? Thank you.
Thank you very much for your question. In our Matsu TC, we have used the different kind of data sources. So for monitoring and also the forecasting, if we use the AI techniques, it's very quick to produce the tropical cyclones, such as their location, their intensity, or their how strong the wind and the rainfall distributed. So it could be produced within several minutes. Yes, it's very quick, and also use the multi-hazard deserts. The produced, we can collaborate with also the numerical model simulation and also AI models to do that. So it would produce, I think it will take a longer time. So just for the crop cycles monitor and forecast, it'd be very quick. But for the longer near-time forecast, it could be. But we have also used the AI model to produce the AI based on the crop cycles, longer near-time such as seasonal or sub-seasonal forecast. It could be produced with several minutes also, maybe half an hour is enough. Yeah, thank you very much.
Thank you very much, Ms. Yu, for your reflection. Let me, because time is short, let me pose the next question to Ms. Prasop. In your presentation on cell broadcast, you mentioned that in the initial phase, the central agencies are sending the cell broadcast alerts. What would be needed to be put in place before the local agencies are able to send alerts for local events? Thank you.
Okay. The cell broadcast is new in Thailand. I mentioned that, and in the first phase, central NDWC can send the message to the area, but we try to training the local government to make the message from themselves, and we have the clear SOP to is a standard operating procedure to the local government to make it. And we have the example message with the cap to has the example to the local government. But if the local makes the message by themselves, the NWC is in charge to approve the message before dissemination to the people in the area. Yes.
Thank you very much, Ms. Prasop. Now, finally, for the last question to Ms. Eka, you shared the experience of implementing community-based surveillance. What are some lessons learned from the national community-based surveillance in Central Java and West Java?
Thank you, Ms. Karen, for the questions. Yeah, especially for West Java and Central Java, we are starting with one district, each province, and then with the acceptance and endorsement by the government, and it's escalate into all district in West Java, which is 27 district in West Java and 35 district in Central Java. So it's big number, big populations are outreach by the community-based surveillance. So in West Java, especially in Bogor City, is piloting developing national roadmap and guidelines. And then the government partners have a opportunity to visit how it's worked at the community even before the pandemic COVID-19. So community volunteers in urban area is ready to engage in community-based surveillance. They have a specific disease like dengue and TB, and train and mentorship enable volunteers and who had a limited knowledge to better understand on health risk and actively report a potential case in their communities. So these lessons learned make it more stronger even during the pandemic COVID-19. So strong coordination between volunteers at the community and health worker supported by the WhatsApp group, facilitate timely information sharing and early response action. And in Central Java, it's another stories also, of course. It's expanding in 35 district. Boyolali district actually established functioning One Health Task Force. So it's not only for human health, but also animal health. And PME also part of that task force. And we serve this active member of the community-based surveillance task force. So community volunteers demonstrate their strong commitments despite having other jobs. This report, of course, supported the, like for example, COVID-19 response effort through the contact tracing, for example, assisting the self-isolations, coordinating with village midwife and local authorities. So even though during the foot and mouth disease related with the outbreaks, volunteers also contribute to the animal health surveillance, including monitoring and documenting livestock vaccination. So I think it's that the best lessons learned from these both province and escalations the coverage. Thank you, Ms. Karen.
Thank you, Ms. Eka, for your reflections. I'd like to check with my co-moderator on the floor if there are any questions from the room. There are a few questions I see on the chat, but just wanted to check with Ben if there are any questions from the room.
Thank you, Karen. And can I just say you're doing a wonderful job moderating from online. I know it can be challenging, but I can tell you there's lots of appreciative nods in the room, but I don't see any hands at this stage. But we are monitoring the questions online. But as we've experienced in previous webinars, we always run out of time really quickly. So I can assure those who've asked the questions that we will get back to you if we can't do it in this session. But I'm just checking again to see if there are any quick questions from in here. It seems to be that is not the case, Karen. So I'm just going to pass back to you, and then we might start to wrap things up. Thanks.
Thank you, Ben. So we have received a few questions in the chat. So there are some general questions, some specific questions. There is a question on Matsu. So let me just pass it to Ms. Yu. Does the information from Matsu reach all residents in China? And how can they access information if they are not connected to Matsu?
Yeah, thank you very much for your question. Yes, the Matsu Urban and Matsu TC is developed in this year, and also it has been disseminated and used in some countries and also in some regions. So maybe because the system is still under development, we are trying to be open access by all the users. So if you have any question, you can contact, because we actually have some website, but some website is still under development, and we are trying to open the access very quickly. And so please pay attention or refresh or updated information. So if you have any question, you can contact the emails, the core members from development of the team, the Mr. Yang Yu, and also okay. So if you have any question, you can contact. Okay, thank you.
Yes.
Thank you,
yes, if I may, this is String from WMO speaking. So because just a complimentary comment on this question, I think this Matsu system is it's like localized system. It's developed by China, but it can be localized and using existing data sets and incorporating existing systems. It's not replacing mechanism. So, but the answer is yes, everything could be used locally without any outside sources. It can be incorporated in the existing system and data sets. Thank you.
Thank you
Thank
for your
you.
comments and suggestion. Yeah, we'll do that.
Thank you so much. I have there's a question specifically, so probably I'd address it to Ms. Eka. What is the difference between Satu SBM PMI and Satu Sehat Ministry of Health? The data collected is almost the same.
Yeah, thank you, Ms. Karen, and also for the participant for the questions. So yeah, actually the government developed Satu Sehat will be it's like self applications for every individual to record their health histories, including disease also and vaccinations. But yeah, especially but government surveillance system is also have another surveillance system like early warning for health system. So actually the community-based surveillance is raising the informations to government surveillance system. So actually this is also on the discussion between Indonesian Red Cross is part of our roadmap together with the government how to linkage with this system at the community level with the existing surveillance system under government. So we are on the way to do the interoperability data. So this is part of the plan for Indonesian Red Cross and also the movement to have this integration system, because usually our data from Satu SBM, we are kindly reported to public health center and the local health center in the district. So they are the one who inputted in the event-based surveillance. So they have indicator-based surveillance and event-based surveillance. So community-based surveillance is supply the data for event-based surveillance from the community, from government surveillance systems. Yeah, hopefully next time we can have a good news how to integrate Satu SBM into Satu Sehat application with the government. Hope it's helped.
Thank you.
Yeah.
Thank you, Ms. Eka. There was a question in the chat specifically on the line application, but it has been answered, but I'll just read the answer as well. So the question is, can the app be downloaded and be shared outside Japan? This is referring to my timeline. And the answer that was provided by Mr. Tomabeki is you cannot register with an address outside Hiroshima Prefecture. The display is only available in Japanese. You can temporarily set it to somewhere in Hiroshima Prefecture to try it out. So this is just to reflect the question that has already been answered. There is one general question that maybe I'll just open to the panel. How do the speakers view the role of education as a part of disaster risk reduction and early warning systems? If anyone who's interested can from the panel can provide an answer. Either maybe Mr. Tomabeki or Ms. Eka would like to attempt.
Sorry, Karen, it seems no takers for that, but I might include a comment about education in my closing remarks because I think it's very important. It's a good question.
Okay, maybe that will be that's fine. And then I think we have reached almost to the end. Thank you for all your questions and the questions that's in the chat. We have responded to most of your questions. If you have any further questions, please feel free to reach out. If you have any information or any assistance that's required, again, please reach out. And thank you so much for your patience, your understanding, your contribution to make this session very interactive and informative. And with that, let me hand over to Ben for his closing remarks.
Thank you very much, Karen. And thank you to all of the panelists today and also to those joining us online. I did do a quick check on numbers and we did get over the 100 mark. So congratulations. Again, another successful webinar in the series. Just a few quick remarks because I realise we're now over time and we're pressed to get to other engagements. But I really think it's important to reflect on how far we have come over the last 50 years, even over 150 years, if you think back to, pre-technology and so on. But we do live in a very rapidly changing world with climate change really driving impacts in terms of more extreme weather events and also geophysical hazards, making it more challenging for our communities. But there is hope, and this webinar today has given me a lot of hope, and I hope it has to you as well, that there are scientific, technological solutions available. And I really want to thank all of those that are making such a big contribution to work on their own development of applications, but not doing it in isolation. I think one of the key messages out of this is how important it is to design these tools with the community that are using the tools. That's where we're getting the best impact. So with all of these increasing challenges globally, right down to local level, we're seeing these challenges being turned into opportunities. And so I see science, technology, innovation as an enabler for better decision making. I did say I would mention education. I was really pleased to hear a number of the panelists mention community awareness and education and outreach as an important component. I think this is absolutely critical because we could become too dependent on technology. And I think it's really important that we just have a basic understanding of what's happening around us. I like the example from Hiroshima in terms of reading the signs, sensing the signs. So having this awareness of your risk, what to do in the event of a natural hazard. I think we're also seeing a trend towards more personalised solutions. And I think this is part of this co-design process that we're experiencing. We are seeing a lot of high-tech solutions, but at the same time, I think it's important to embrace and integrate the low-tech solutions that really take these forecasts and warnings to the last mile. And data and knowledge sharing is absolutely key to all of this. So the Early Warnings for All, as you know, is undertaken by 4 key pillars led by United Nations Office of Disaster Risk Reduction, World Meteorological Organization, International Telecommunications Union, and the International Federation Red Cross and Red Crescent Societies. All the panelists represented those pillars, but I want to take a moment to really acknowledge and thank ESCAP for all of their incredible work pulling all these elements together, focusing on transboundary hazards, really pushing impact-based forecasting. That's another development that we've seen over the last decade or so, moving away from sort of isolated forecast warnings to take a more integrated approach, a more transboundary approach, looking at multi-hazards, at cascading, compounding and complex risks to really understand the world we live in and to respond appropriately to it. So there are many, many takeaways. I won't go through all of the speakers in turn, but I think I've captured the key sort of elements. But really, I think a key message for all of us, and I just want to sort of maybe paraphrase one of our speakers, it begins and ends with community. And I think it's really important to focus on that local context. That's where the risks are hitting the ground and having the impact. That's what will drive the solutions. But without our ability to work together for the greater good with the interests of the local community in mind, we will go nowhere. So let's keep going together. Let's keep innovating, keep sharing the outcomes of our work from the high tech through to the low tech. And I think we will go a long way towards adapting to climate change. Thank you all very much for joining the webinar. We will draw it to a close. Apologies for keeping you for an extra 5 minutes. I want to also thank Karen for doing an excellent job moderating. We will continue to monitor the questions and respond to them online. And thanks very much to ESCAP for inviting us all here today and running our first successful hybrid webinar where we've had some in-house people as well as those online. Thank you all so much, and we'll call it to a close. Unless you need to say anything from a housekeeping perspective, Karen. Thank you very much.
Thank you so much, Ben. Not so much more, just to say to advertise for the next webinar. If So we have a financing advancements in early warning systems, and we look forward to you joining our next webinar. The date will be announced. So thank you so very much, and thank you for joining us. And this webinar is now closed for sure. And have a very good day ahead of you. Thank you, everyone.
Thanks, Karen. Thanks, everyone.
Yeah, thank you, everyone.